Ailsa Rutter, Director of Fresh and Balanced North East. Looking forward to finding out what that is. And we have 20 minutes, colleagues, for this session, so Ailsa, if you could kindly introduce yourself for the record and add a sentence by all means if you wish to, but then we'll have plenty of questions for you. Thank you.
Thank you so much, and I'm absolutely privileged to be here and speaking with you this afternoon and speaking on behalf of the North East and the many partners in the region who are going to give you their overwhelming support for this absolutely crucial, once in a complete lifetime opportunity to take the single biggest impact to address the biggest cause of cancer in particular. For those of you who might not know who Fresh and Balanced are, we're a regional tobacco and alcohol programme based in the northeast of England. We've been going for 20 years. We're funded by our local authorities and our NHS trusts.
Okay.
And we're doing a lot of work to drive down the harms on both tobacco and alcohol.
Thank you very much. Thank you. Thank you.
Thank you. My first question is, what's the impact of tobacco smoking on public health? And then my second question is, do you think that the bill's measures to prevent vaping products to children will be successful, essentially clauses 61 and 62?
Thank you. Tobacco is devastating. It's devastating to every individual who dies way too young. It's devastating to the family who lose their loved one. And in my region alone, just since the turn of the millennium, 120,000 of our loved ones have died from smoking. And it's not an adult choice, it's a childhood addiction. And those smokers, the vast majority of them, reach a point where they deeply regret having got hooked in childhood. They don't ever think that first puff on a cigarette is going to be so addictive. And I think it's really important today that we remember the 6.4 million remaining smokers in the UK and the fact that 350 18 to 24-year-olds are going to get hooked to lethal tobacco smoking today. I'd like the committee to really imagine that cigarettes didn't exist. It's 2024, and here we are discussing a product that is designed to hook, to kill, to maim, to be completely addictive. And I think this discussion today needs to be about the future world that we want to strive for. We can talk a lot about how we're going to enforce it, etc., and that's very important. But for me, this is about imagining in 20 years' time, we have created an entire new generation who are going to be protected from this uniquely lethal product. So that is why, in the North East, the wholehearted support from all 12 local authorities, all 10 NHS trusts, our Integrated Care Board, which is the biggest in the country, our Association of Directors of Public Health have given a unanimous support in terms of the stopping the start and the age of sale of tobacco proposal. In respect to the question about youth vaping, absolutely, we recognise that smoking is much more harmful than vaping, but vaping is not risk-free. But vaping is playing a pivotal role in our region with our higher levels of deprivation and addiction to get people off lethal smoking. That is not to say that we don't absolutely agree that much more needs to be done to reduce the appeal of vaping to young people. So we wholeheartedly and have responded to say we must address the inappropriate packaging that is too youth-friendly. Some of the in-store promotion, that's where children are really noticing it, is completely inappropriate as well. But we must ensure that we recognise that children are growing up within a family context. So children don't live in isolation. So the importance in our region also is sending clear messaging, evidence-based messaging, because we also can see the positive impact on children's health if we can get the parents and carers off lethal tobacco smoking and the reduction in second-hand smoke harm. And really importantly as well, more money in people's pockets, because of course cigarette smoking is such a negative thing on your income.
Minister Angela Epson.
Thank you. Thanks so much for being here, for all you do in the North East, which is fantastic. A particular question, as you will know, smoking during pregnancy in the North East is some of the highest in the country, and I just wonder, do you think that this legislation will help to reduce those very high numbers? I think something in the region of 14% in the North East.
So we've made really good progress
Yeah.
in the North East to reduce maternal smoking, and that's come through very good collaboration between our local maternity services with our local authorities, the fantastic leadership that we've had from key people in the LMNS, and with the direction of our Directors of Public Health. And I think with anything, there isn't one magic solution. It is about taking comprehensive measures. And the age of sale increase of tobacco undoubtedly will have a really positive impact to reduce maternal smoking. It also needs to be coupled with the things that are very important to continue to do as well. So we also really welcome the increased investment to stop smoking services. We hugely welcome, thank you, the reinvestment in the evidence-based health harms campaigns, and we're thrilled that nationally you're using our fantastic Smoking Survivors TV advert featuring Sue Mountain. It's also really important the role of financial incentives, for example, which we know have got a very strong evidence base, but I think this will have a positive impact on maternal smoking.
Thank you.
Thank you. Happy. Nikki Aiken.
Thank you very much. If there was one thing you could add to this bill, what would it be?
Gosh, well, I think there's some fantastic elements already in the bill, and I think the key thing for me is to make sure we can get this bill through, and particularly the focus on tobacco. And I think, you know, it's really good to think you're going to have subsequent consultation around the very important elements around vaping. I do think factoring in what colleagues previously said is we do need to have it simple mandatory age verification scheme. So I think that's already in place in Scotland. So I would certainly welcome that. That would also be introduced in terms of England.
Thank you.
Thank you. Trudy Harrison.
Thank you, Chair. And thank you, Ailsa, for all the work you do up north in the North East. I represent the North West in Cumbria, and we also have higher than average national rates of mothers that say they're smoking at the point of birth. It's about 12.3%. And in Cumbria, I'm told by our authority that it's about 3,500 hospital admissions, 74,000 GP appointments, 80,000 sick days, all caused by smoking-related illnesses. But why not just do more of what you're doing in the North East? Why do you really, really need this bill in order to tackle the problem?
So I think we're doing some really good work in the North East, but I absolutely think that this bill is required, because I go back to the point about the uniquely lethal nature of tobacco smoking. And I think this is the one key argument that I think we need to think about. This is guaranteed to kill. So for me, I think this is about a societal shift, and I am really pleased with the huge shift in the North East around the social norms of smoking. And we talk to people who smoke every single day, and they have your backing actually, because they desperately don't want their own children to fall into the same trap. And I think this is about aspiring, as I mentioned before, into the future. And we're all very conscious of the pressure and the strain on our NHS. And if we think about, you know, the impact 1 in 4 beds in the North East and elsewhere, you know, with somebody who's suffering from a smoking-related condition. So I think our NHS colleagues in particular really welcome this. The other aspect I think is very important if we think about the economic costs is we all get the healthcare costs. We also really understand the strain on social care. But actually it's business that bear the brunt from this, and that can surprise people. But it is about the lost productivity. It's about the people who are having to retire early, they're dying early. And I would just like to really think about who these people are as such. And I've mentioned Sue Mountain, I've mentioned her pivotal role and her TV advert being shown. But we've had so many other people come forward who sadly were diagnosed in their late 40s, women in the North East who are desperate to tell their story. So Cathy Hunt, 49, diagnosed with lung cancer. Claire Oldfield, 49, diagnosed with lung cancer. And their real appeal to you today is to think about taking this seismic leap forward in the leadership that the UK can show globally, actually, by recognising that smoking had a beginning, it had a middle, and it's down to us to say it can have an end.
And thanks to Ailsa for everything that Fresh does in the North East and the wonderful results we've seen in the North East, which is a very deprived area in places. I just wanted to follow up on the around the question on evidence and vape. And although there are still a few grey areas and unknowns about vapes, what we do know is that it is much less harmful than tobacco vaping. And crucially, it's a really important tool for those people who do smoke. So what's the evidence that Fresh use to back up this argument? And do you feel that there could be a worry that if we focus too much in this bill on youth vaping, that we leave behind those very dependent, addicted and very often deprived smokers?
Thank you. So I think we're really fortunate in the UK, and the UK has shown great leadership in this by commissioning completely independent of government evidence-based reviews, and we've had 8 of those now since 2014. And I think that that's been incredibly important. Fresh is not complacent. Fresh has been monitoring the evidence around the rise in vaping and, you know, how this is positioned in terms of public health, you know, for the last 20 years since we were set up. And I would really strongly recommend that many of the questions, really useful questions that we've had today, can be answered actually from looking at those systematic reviews from the Office of Health Improvement and Disparities, in particular around when people are saying we don't know what's in vaping. There's a really significant chapter on what are the constituent chemicals, etc., in vaping and the magnitude of potential harm as such. I've forgotten the second bit of your question, Mary. Sorry.
Well, it was about the use of vapes on those heavily dependent smokers.
Yes. So in the North East, vapes have been, quote, a game changer in terms of some of our heavily addicted smokers, and I have permission to share with you the fantastic role that they have played in our biggest mental health trust, Cumbria, Northumberland and Tyne and Wear. We're talking about people who have been smoking 40, 50 cigarettes a day for often decades, who have really, really struggled to ever imagine that they could get off lethal smoking. So being able to give them something that has given them still their nicotine, but in a much, much purer, safer, cleaner form, has been a game changer. Vapes are being used very successfully in our drug and alcohol treatment services, and on the point of alcohol as well, you know, the two often go hand in hand. And I would say to committee, if we are really intent to see an end to smoking, we must be doing more on alcohol. And wearing my balance hat, I think it's really important, balance is the alcohol bit, is we don't just think of risk-taking behaviour in youth as just vaping. So the World Health Organization last week published a report that shows the UK, sadly, across 44 countries, has the highest use of alcohol in 11-year-olds. Now, I don't think anyone can, I hope nobody thinks that it's okay, the amount of alcohol promotion, advertising and marketing and things as well. And I think it's just quite important that we do look at risk-taking behaviours in the round.
Thank you, Mr. Chairman. You've raised, in answer to my colleague Nicky Aitken, the primary issue in terms of age verification. But obviously we only get one of these opportunities to change the law in terms of tobacco and vaping once in every 10 years or so. So it's quite important that we get as much in there as we can. What other improvements would you like to see to the bill to strengthen the argument you're putting to get people to quit smoking or not even start in the first place?
That's a really good point, and I mean, I think it goes back to, you know, not wanting to delay the progress of the bill as such. I really do hope that, and it's not necessarily for legislation, but I think it is very important that we have a very clear communication strategy for this. And I think reflecting on previous legislation, much of the high levels of compliance we've seen in this country come from very proactive communications in advance of that. And I think we need to be really careful that the narrative doesn't get overly confused, because it worries me enormously, I will say, that too many people are staying on smoking because they are being scared of even trying to give switching over to a significantly less harmful product. And I do worry enormously around scaring. I think it's absolutely right that we have evidence-based messaging to children and young people, but they're messengers. They are messengers who go back to their parents. And we know that it's very important that, you know, they're sending clear messages back as well. So in terms of an additional amendment, I will defer that, sorry.
So can I just prompt you? I mean, obviously we've heard from the previous witnesses about licensing. We've talked about, I think the Minister has talked about warning messages in packs and also individual cigarette papers.
Yes.
Would you support those sort of measures?
Yes. So I would absolutely support, and Fresh has been advocating for many years around tobacco licensing scheme. Whether it's within the parameters of this bill, I don't know, but I absolutely think it's wrong that anybody can basically set up out of their car boot and sell a lethal consumer product. I would also strongly recommend that previous consultations on things like pack inserts are looked at again. There's a very strong rationale for that. And also Canada now is leading the way in terms of very clear message on the cigarette stick itself and called dissuasive cigarettes. So certainly there are other things that are in that realm. And of course, I would also in the future be really willing to discuss the role of a polluter pays levy, because I do think that is something also worth considering.
Thank you. Got 5 minutes left, maybe 4 minutes in fact, and 3 people have already caught my eye. So short questions and short answers, please, colleagues. Thank you. Mary Glindon.
Ailsa, it's always great to see you, and your enthusiasm is showing through. We're very grateful for what you do in the North East with Fresh and Balanced. Perhaps just asking a little bit more about if this legislation is to be as successful as we all want it to be, does there need to be some kind of balance, open intended, between how education and enforcement can make this a successful campaign and bill to become enactable forward?
Thank you. Well, I think we've got a really good track record collaboratively over the last 2 decades of cross-party working and with fantastic support from civil society, from NHS and local authorities, and the previous legislation has gone through, really well overall, and it has been because we've worked together, we've built up public awareness, public support. I think it is absolutely important that we have the adequate resourcing for our really important professional groups such as trading standards and things as such. But I think for me, it's about the communication, it's about the vision, it's about the narrative that we can set. And undoubtedly, I think if we can get this through, it's not just about stopping the start of that whole new generation, but we also know this will trigger many, many people thinking, you know what, I'm going to give it another go. I am going to try to quit. We know it can take people many, many times to quit for good. And that's why it's really good this is being backed up by the additional investment to the really important stop smoking support systems and also within our NHS trusts as well.
I heard this morning that some individuals and families, parents, had misinformation really about vaping. For instance, we were given the example that where flavours were grapefruit or fruity flavours, that they might think that it's actually beneficial for children to be using them. Should we be doing more in terms of education in that sense to make sure that families are aware that because something has a fruit flavour on it, then it doesn't necessarily mean that it's it's good for their health, and also tackling those types of flavours as well?
So thank you. I mean, I note the aspects of the bill that are around flavours, and we absolutely think that more should be done on the descriptors, and we wholeheartedly agree that some of the description is completely inappropriate, but flavours do play a really important role, and particularly for example in our mental health trust, the fruit flavours have been the flavours that have successfully got addicted smokers off. I genuinely haven't heard that come up in the North East in terms of perceptions of parents thinking it's somehow healthy to have a fruit flavour to a young person. I think what is wrong though is if that's in a packet that's called unicorn, bubbly, shaky, whatever, with a cartoon image on it. That they are things that we should look at addressing. And interestingly, just in terms of vaping in the North East and in young people, a point I do want to make is I do think we need to be careful about the data. So we hear sometimes people saying all young people are vaping. The evidence does not stack that up. We have all of our local authorities do health behaviour questionnaires. Across the board it was around 10%. Which was occasionally vaping. Now, I'm not at all saying that we should be happy with that as such, but there is a risk by a public narrative that all young people are vaping is we inadvertently promote this as a norm as such. And Schools North East...
Sorry, now hit 10 to 3. Caroline, I'm sorry to you too. We're not allowed to go over the time limit. So, Ailsa, thank you so much for your evidence. It's been absolutely first class. Thank you.